Okay, so the next assessment I'll be describing is internal and external hip rotation of the iliofemoral joint. Optimal range of motion is 45 degrees for both of those, and then really we're assessing the same muscle groups. So the muscles that we'll be assessing for both are the external hip rotators, some adductor muscles in the hip, and then your glute med and your glute max, as well as the pisiformis, and then some underactive muscles that may limit range of motion here are going to be the adductor magnus and longus and brevis, as well as the TFL and your gracilis and the medial hamstring complex as well. So when we set up, we're going to have the person laying supine, just like for the knee extension. We're going to passively get their hip at 90 degrees and then get their knee at 90 degrees as well. We want to make sure that the hip is in neutral and is not rotated at all. So then from there, when we put the glumometer on, when we assess this movement, we're going to put the glumometer on the top of the knee, and we're going to put it on top of your patella anteriorly, so that's the top. And then we're going to draw an imaginary line in the center of the body with the short head, or the head without any numbers on it. And then we're going to get the measuring head in line with the anterior mid lower leg, so just straight down here is where we're going to put the measuring head. And then from there we're going to, so for anterior hip rotation, we're just going to passively bring the femur in, so holding in at the lateral leg and the thigh. We're going to rotate inwards until the first resistance, and then for external rotation we'll do the exact opposite, but grabbing in the same two places. We're just going to rotate the leg externally until you see any compensation or the first sign of resistance. Then from there you'll take your measurements, and that'll do it.